Well, many people might think that sleep apnea is just an adult problem, but it also affects children, and that could affect their health. Joining us via Skype is Dr. Dmitriy Vaysman, the medical director at Catholic Health Services Good Samaritan Pediatric Sleep Center. Thanks for joining us.
Thanks for having me.
Now, when should a parent be concerned that their child's trouble getting to sleep or staying asleep might be it might be a medical condition?
Normally, children should be able to fall asleep within, 20 to 30 minutes. If child spends a longer time around bedtime and keeps having nocturnal awakenings, it can be a reason for concern for the parent to see if some underlying conditions are causing the problem.
What are the most common sleep problems that you see?
The most common sleep problems we are dealing with are obstructive sleep apnea, insomnia, bedtime difficulties in younger children. We see a lot of teenagers with, difficulty with staying and falling asleep, difficulties waking up at reasonable time to be able to attend school.
Now, what is a sign that a parent should look for that their child may have sleep apnea?
So the most common symptom of sleep apnea is snoring. Children also frequently move a lot during their sleep. They sleep in awkward positions, for example, with their neck hyperextended. They can grind their teeth, which can also be a sign of sleep apnea. Sometimes bedwetting also can be a symptom of sleep apnea.
All things that many parents, including me at times, probably didn't realize that could be more of a problem.
That's correct. Snoring being the most common symptom of sleep apnea is very common. About 40 to 50% of children snore, and about 5% of children can have obstructive sleep apnea. So we know that parental observations, video recording doesn't always correlate very well with the fact whether child does or doesn't have obstructive sleep apnea. A lot of times, unlike adults, children don't have this, overt symptoms where they actually stop breathing and gasp for air. A lot of times symptoms are more subtle, and we frequently have to perform overnight sleep study to determine if child just snores and has something called primary snoring, or child has actual form of obstructive sleep apnea.
Yeah, tell us about that. Tell us about the sleep center and what you do there.
So we are a freestanding pediatric sleep center. We evaluate and treat children of all ages, starting from newborns and up to the age of 21. So the regular evaluation usually consists of physician evaluation of the child and the family. And based on the evaluation, we determine if child does or doesn't need to have overnight sleep study. If child needs overnight sleep study, it's performed here at the Pediatric Sleep Center, which is a child-friendly facility, which involves spending the night here at the lab. And sleep laboratory is like a hotel room with 2 beds, one for parent, one for a child. There is also a crib available if child is an infant. Rooms are all children friendly. Our technicians are trained to work with children, and it basically involves, monitor a lot of physiological parameters during the sleep, including children's brain waves, respirations, heart rate, eye movements, and oxygen level. The test is non-invasive. It's just monitoring overnight. And usually in the morning, child, gets woken up and everybody goes home. After that, the study has been reviewed and scored, and we come up with a diagnosis and the treatment plan.
Yeah, we saw the rooms. They're very beautiful. They're decorated gorgeous for kids. Am I just out of it? Or, I know adults had these overnight. They would have their, sleep checked overnight. Is this relatively new for children having overnight, sleep?
Sleep medicine in general is a relatively new field. Sleep apnea, for example, was coined as a term in early 70s. Like everything in medicine, children are a little bit, behind. So obstructive sleep apnea in children has been known now, for quite a long time. Our center has been around for about 14 years. So we've been doing sleep studies for children here for 14 years.
And I'm guessing early diagnosis is the key here.
Yeah, early diagnosis is very important for a few reasons. First of all, we know that obstructive sleep apnea in children can cause, some long-term complications. And most common complications of obstructive sleep apnea in children are behavioral problems. For example, children who suffer from obstructive sleep apnea can exhibit behavior similar to children with, for example, ADHD. Children can have behavioral issues and learning problems in school, which can be a result of disrupted sleep. So early diagnosis and treatment can be a major factor in improving child's life and learning, etc.
So very important for every parent really to talk to their pediatrician if they think their child, is not just having a little trouble sleeping that, you just sort of blow it off, but really this could be a disorder.
That's correct. So, sometimes we hear that parents say, hey, yeah, everybody in the family snores, and it's considered to be normal, although it might be, but a lot of times it also can be a sign of, obstructive sleep apnea.
Okay, Dr. Vaysman, thank you so much.
Thank you.
Very important information for all parents out there right now.